Okay, we'll get started. Good morning, everyone, and welcome to Global Perinatal Services 2024 End of Year Review. My name is Zainab, and I'm honored to serve as the Communication and Resource Development Manager here at GPS. Also here with me today are my amazing colleagues, Denise and Taylor. Before we dive into today's presentation, I want to take a moment to sincerely thank each and every one of you, our donors, stakeholders, and community partners. Your unwavering support, dedication, and belief in our mission make everything we do possible. And your presence here today is a testament to your commitment to creating better futures for families in underserved communities, ensuring that every parent and child receives the care and support they deserve. We've accomplished so much this year, and it's all thanks to you. And together, let's reflect on 2024 and look forward to an impactful 2025. 2024 was a transformative year for GPS. As we look back, we see a year full of milestones, challenges met with resilience, and communities served with compassion. This review will highlight the ways we have worked together to create lasting change. Now let's dive into an overview of GPS and the work that we do. Next slide, please. At GPS, we remain deeply committed to our mission, which is creating culturally responsive pregnancy and parenting experiences for Black, immigrant, and refugee families. Our vision is bold yet simple: to ensure that every mother and baby not only survive, but thrive through pregnancy, labor, and beyond. This mission drives every decision, program, and partnership we've cultivated over the years. Today, you'll see how this commitment has translated into measurable impact and meaningful change for the families that we serve. Next slide, please. GPS offers a range of programs designed to address the needs of families during pregnancy, postpartum, and beyond. These include doula services, lactation support, case management, and our easy access clinic and support groups. We'll provide more details about each program throughout the session, but this slide should give you a quick overview of the comprehensive care that GPS provides. At GPS, we serve families in over 16 languages, and that just boggles my mind. That's amazing. Ensuring that no one feels excluded due to a language barrier. The most common languages spoken by the families we serve include English, Somali, Amharic, Arabic, and Oromo. This linguistic diversity reflects the cultural backgrounds of our communities and highlights our commitment to providing care that is culturally and linguistically responsive. In 2024, GPS hosted several key events that created meaningful connections and celebrated the families that we serve. Our Black Breastfeeding Week was awesome. This week-long celebration highlighted the importance of Black breastfeeding in Black communities, providing education and support to Black lactating parents. Our Afartan Bah postpartum baby shower was a unique event that offered a cultural twist on baby showers, and celebrating new families and fostering connections among postpartum parents. Our amazing summer pool parties were events that encourage families to relax and connect in a fun and welcoming environment. And one of my personal favorites is our amazing screenings. This year we had 2 screenings, the Birthing Justice and At Your Cervix screenings. And these powerful film screenings sparked important conversations about maternal health inequities and the work being done to address them. And Black History Month, Read Alouds, and Black History Month is right around the corner next year, was a family-focused event that celebrated storytelling and literacy while connecting families to their cultural roots. And our support groups, doula cafes, these were gatherings that created safe spaces for families to share experiences, connect with doulas, and build community while discussing important topics like mental health and parenting. Each event created opportunities for education, healing, and celebration, making a lasting impact in our communities. And in 2024, GPS hosted several key events that created meaningful connections and celebrated the families that we serve. Oh, I'm back with the same slide, sorry. In 2024, GPS made significant contributions at conferences and in leadership initiatives. At the BIPOC Birth Workers Needs Assessment in Eastern and Central Washington, we shared insights about the challenges faced by underserved families and advocated for culturally competent care. This work helped shape broader conversation about systemic disparities. Through our partnership with CityMatch, we on improving postpartum care by enhancing hospital discharge folders statewide. Our goal is to make these folders culturally responsive, ensuring that they include services and resources that the families will actually use, and that information is delivered in a way that aligns with their cultural needs and experiences. This initiative helps families leave the hospital better equipped for a successful transition into parenthood. Our presence at these events reinforces GPS's role as a leader in maternal and infant health and health advocacy and innovation. And in 2024, GPS had the honor of hosting the amazing Jenny Joseph, a globally recognized maternal health advocate and leader, to accredit our Easy Access Clinic. And this accreditation established our clinic as the first of its kind in the state, and GPS became the first nonprofit to achieve this milestone. And Jenny's work extends beyond midwifery. She is the creator of the JJ model, an internationally acclaimed approach that improves maternal and infant health outcomes by focusing on access, connection, knowledge, and empowerment. Her visit was a pivotal moment for GPS, underscoring our shared commitment to equitable, culturally responsive care and systemic change. In June of 2024, GPS officially became a perinatal safe spot, further solidifying our commitment to providing inclusive and supportive care for families. A perinatal safe spot is a space, physical, virtual, or both, where families can safely connect and access the support they need while applying the 4 tenets of the JJ Way model, which are connection, access, knowledge, and empowerment. This recognition highlights GPS's dedication to fostering equitable, family-centered care and improving maternal and infant health outcomes. And in April 2024, GPS hosted the Health Connect One team for a 3-day visit and successfully completed the accreditation process. GPS has been implementing the Health Connect One community-based doula model since 2018, strengthening our commitment to providing culturally responsive, community-driven perinatal support. And in summer 2024, GPS hosted 3 impactful listening sessions to better understand and address the needs of the communities we serve. The Healthcare Authority listening sessions, we held 2 sessions focused on after pregnancy coverage and engaging Medicaid recipients to discuss barriers in accessing care and opportunities to enhance postpartum services. These conversations provided crucial insights into the gaps and challenges families face during the postpartum period. In October 2024, we partnered with Molina Healthcare to host an important information session at our Federal Way Birth Center. And this session provided a space for Molina members to share their experiences with healthcare coverage during pregnancy, postpartum, and beyond. And participants identified gaps in services, highlighted areas for improvement, and provided valuable feedback that will inform our future advocacy and programming. This collaboration underscored our shared commitment to equitable, culturally responsive care and reinforced the importance of listening to community voices to guide our work and better serve families. And of course, one of my favorites as well, GPS's support groups serve as a space for families to connect, share, and heal. These groups cover critical topics such as mental wellness, family planning, and breaking cultural stigmas, but their impact goes far beyond education. They serve as communal healing spaces for marginalized communities, addressing the mental health needs of parents who often face systemic inequities. For example, Mom's Corner has provided a space for parents to discuss challenges like disability, stigma, and mental health while finding solidarity and support. These groups are lifelines for our families and fostering resilience and a sense of belonging in the communities that we serve. GPS support groups continue to see strong attendance, reflecting the deep need for culturally responsive spaces where families can connect and receive support. And through Mom's Corner, Afghani Sisters Corner, Oroma Sisters Corner, and Father to Father, participants have engaged in meaningful discussions on mental wellness, family planning, work-life balance, and other key topics. These groups are more than just conversations. They provide a bridge to critical resources and services that families might not have otherwise known about or have access to. From healthcare referrals to financial assistance and parenting support, these sessions help families find practical solutions to the challenges they face daily. The strong and continued engagement in these groups underscores just how vital they are to the families we serve. And with that, I will hand it over to my colleague Taylor, who will walk us through the next part of our presentation. Thank you for listening.
Thank you all for being here. I'm going to discuss our doula programs. The heart of our organization is doula support, and we're so happy to talk to you about all the things that we've accomplished this year. Next slide. So for doula enrollments per month, our birth doula program, we've had 298 enrollments, and community-based doula program, 33 enrollments, with 60 families served also for our 20-hour postpartum doula support program that we implemented, which is really beneficial for families to get that ongoing postpartum support after their birth. And we're really proud to see these numbers and the growth that we've had in this organization. Next slide. So our number of births are 213 for our birth doula program, with December being our highest month, and our community-based doula program, 27, with our June month being the highest. We have a lot of births sometimes in the summertime. 94 clients identified as first-time parents. So most of our clients are first-time moms. They require a ton of support, education. A lot of these moms attend our lactation, childbirth education classes, and other services with GPS. So we're really happy to be able to serve first-time moms and really educate them and heal them and help them grow as moms. Next slide, please. Method of delivery. So most of our births were vaginal births, 76%. So 162 out of 213 vaginal births. 9% were planned C-sections. 14% on community-based doula were planned C-sections. So about 4 in 27 births. Unplanned C-sections, 14%. So about 31 out of 213 births. So most of our births are vaginal births. We advocate for it. That's what doulas are here for. So we try to make sure that they have a vaginal birth if that's what they wish, and then be there for their C-section if it ends up being that. So we're very proud of these numbers. Next slide, please. Our NICU and breastfeeding initiation rates. So this one I'm really proud of as a breastfeeding mom myself. Our birth doula NICU admissions are less than 1%, so 2 out of 213 births. And then their breastfeeding initiation was almost 100% at 96%. So about 206 213 of our clients initiated breastfeeding after delivery. So we're really proud of these numbers. We really are big advocates for breastfeeding, even if moms just try it. We have ongoing support groups, Zooms, we do home visiting. So there's a lot of ways where moms can still, receive help after they go home for lactation support. And we really want, if moms want to, we want to figure out how we can help them do that and be successful at it. Our community-based doula program, NICU, was 3%. So 1 out of 27 births, and then breastfeeding as well, 92%, so 25 out of 27 births. So we're so proud of these numbers. Breastfeeding means so much, the outcome, the health of the babies, and so we're just really happy to help moms do this. Next slide, please. Our preterm birth rates are 7%, so about 17 out of 213 births. Full term, 77%, 166 out of 213 births. And term 14%, so about 30 out of 213 births. And our community-based doula, about 14% of them were preterms, so about 4 out of 27 births were preterm. So we're very happy about these numbers as well. Next slide, please. I'm going to discuss our GPS doula certification program, another program I'm really happy about at GPS. This is the first ever of its kind, Black women-owned certification program. We're trying to break barriers, make it easier for doulas to get certified, and really make it culturally appropriate and intentional. And I really enjoy certifying doulas. Next slide, please. So for our doula certification, we certified 28 doulas. We 76 of those, 76 people purchased packets, so some of them are still in the certification process. We were able to provide a BIPOC doula training. 22 doulas were trained by our executive director at GPS. We're really grateful that she continues to offer these services to train doulas. A lot of these doulas that are trained end up working with us. They end up thriving in their doula roles. And I know I did myself. It was life-changing for me, and I know many of the doulas that were trained with me. So it's so nice to see, this ongoing, and to see doulas continuing to want to be doulas, to have success with their doula, and then think that this is something that I want to do as well. A lot of our doula certifications are in Washington State, but we've also had, because it's global, we've also had California, Florida, and Oregon certify with us as well. I continue to reach out to different states and let them know about this program because it is global. So if you know anyone in other states, please send the doulas our way. We're very happy to. Not only are our doulas at GPS certified, but they're also MPI. They have their MPI numbers with the new DOH implementation, and we were able to do that as well. So we're very happy about that. Next slide, please. I'm going to pass it over to Denise, and she's going to talk about our lactation program. Thank you.
Thank you, Taylor. Next, we will review our lactation support programs. At GPS, we offer culturally relevant lactation support to families who currently lack access to these essential resources. The photo on the screen features our incredible doulas who completed a 3-day lactation training back in September with our International Board Certified Lactation Consultant instructors. As a result of this training, these doulas can now provide support in their primary languages, and that includes Somali, Spanish, Dari and Farsi, Amharic, and also in Russian. And we do have a few of them here in this room, so welcome in, and we're so glad that you joined the training. So some of the lactation services we offer include our Easy Access Clinic, our weekly hybrid drop-in lactation lounges, our lactation hotline, our IBCLC home visiting, and also our doula lactation mentorship program. So GPS has partnered with the Department of Health of Washington to continue our lactation hotline, allowing community members from all over the state to connect with lactation specialists trained to troubleshoot any lactation issues via call or text. This program provides empathetic and knowledgeable advice over the phone to address concerns and answer questions, and really to empower individuals for their breastfeeding journey. And in 2024, our team has made 419 contacts with clients. GPS offered both virtual and in-person sessions at our lactation lounges, where families could receive that one-on-one support from a lactation specialist. And we held 30 sessions with 67 participants. Our Easy Access Clinic allows patients to meet with a lactation specialist as well and get assistance with ordering a breast pump during their appointments with their midwife. Last year, our lactation specialist supported around 70 clients. GPS provided IBCLC consultations for families needing additional lactation support, and our IBCLC was able to serve 9 clients. Additionally, we were able to offer doula lactation mentorship programs for our doulas where we can provide valuable insights and support for the doulas seeking lactation certification, and that can include peer support certification, CLC certification, certified lactation counseling, or the IBCLC certification. As well as opportunities for them to discuss relevant topics, such as anything that their clients might be facing in terms of lactation, and consult with other birth workers and also an IBCLC for next steps and a plan of what they could provide the client. We held about 9 sessions last year, and that was attended by over 25 doulas and birth workers. We will next review our case management program. This is designed to support the Afghan, East African, and African American communities. Our services include providing birth doula support, postpartum assistance, childbirth education, and lactation support, available both in person and also virtually. Additionally, we serve, our case managers serve as a resource connector, referring clients to other necessary supports. Our 2 case managers successfully served clients with children aged from prenatal to about 5 years old, achieving a total of 61 enrollments. They provided wraparound services and referrals for families seeking assistance, various needs, and that includes baby item support, health insurance connection, lactation support, and also connection to mental health services. In addition, our case managers completed a total of 58 referrals. Many of them were the services that were mentioned just before. And as Zainab mentioned, the Easy Access Clinic utilizes the JJ-Way model that is designed to reduce disparities and improve maternal health outcomes. And the goal is to ensure that every parent who chooses to give birth has the opportunity to have a healthy baby, because every parent deserves that chance. There are many services offered within the Easy Access Clinic, and that includes pregnancy and women's care, such as prenatal and postpartum care, blood work or labs, belly checks, and also pap smears and annual checkups with female providers. We also do make referrals over to our lactation support, childbirth education, ultrasound services, doula support, and also support groups that were mentioned before. And our clients are able to give birth or deliver at different birth settings, and that includes home births, birth center deliveries, and also hospital deliveries. In 2024, the Easy Access Clinic successfully provided care to 79 patients, offering a total of 375 appointments throughout the year. These appointments were spread over 79 clinic days, allowing the clinic to effectively cater the needs of the community. And each session was aimed to deliver comprehensive support and guidance for our patients. Next, we will dive into our final section. 2025 brings many exciting opportunities to GPS. What you can expect in 2025 will be implementing the HCA doula Medicaid reimbursement starting this month in January, and also assist our GPS doulas with obtaining their NPI numbers, which Taylor had mentioned before and has done a great job doing. We also want to expand the number of doula clients that we can serve each month. Currently, we are serving about 20 to 25, and in 2025, we would like to increase that number to 50 clients per month. And then additionally, we want to onboard at least 10 doulas for our birth doula program to accommodate that increase. You can connect with GPS by visiting our website, globalperinatal.org, or emailing us at info@globalperinatal.org, or also giving us a call using that number 206-679-0782. And feel free to share that number as well. And also check out our social media pages, and that includes Instagram and Facebook, where we will be posting updates regarding our events or any updates regarding the organization that you can check out. And in closing, we at GPS, we're not only just providing care, We're leading a movement to dismantle systemic barriers and redefine what quality, culturally responsive maternal care looks like. Every family deserves dignity, support, and access to care that truly meets their needs. The impact we've shared today is not only possible because of collective action. Every conversation, every partnership, and every commitment moves us closer to a future where equitable maternal care is the norm, not the exception. And we're just getting started. GPS is poised to become a world leader in maternal health, driving meaningful change that reaches far beyond our local communities. This is not just an organization, it's a global movement, one that grows stronger with every advocate, partner, and supporter who joins us. We invite you to stay engaged, whether that's through advocacy, collaboration, or simply amplifying the work being done. When communities come together, lasting changes happen. Thank you so much for the support and your belief in this mission and for being part of the GPS journey. Thank you so much for also attending this presentation. We had a big year in 2024, and we're looking forward to what 2025 has in store for the growth of our organization. So thank you, everyone. We will be here for a few minutes if anybody has questions, but again, thank you for joining, and we'll also post our slides on the website as well if anyone would like to refer back to it.
Thank you all for being here.
Absolutely. Thank you guys so much.
Thank you. Great to hear about the year's work.
Thank you for that. Really appreciate you being here, Jocelyn. Thanks. Bye.
Thank you all. Great presentation.
Thanks, Dad. That's nice to know, Bolang. Thank you for being here. Wow. Really appreciate it.
A little bit late. I was having some tech issues, but yeah, again, I appreciate all the work that y'all do and very impactful. So
Thank you so much. Thank you for your support and for being here today as well, despite the technical difficulties, which just seemed to happen at the right, yeah.
Yeah, no, for sure, for sure. So, but yeah, I'm always referring folks, to GPS and any families that can take advantage of the resources. So, yeah.
Yeah, we appreciate that. Thank you.
Of course, of course.